The Centers for Disease Control and Prevention is the department of the federal government that analyzes diseases and associated risk factors in the United States. The CDC has developed a list of youth risk behaviors that are listed on this slide. Unfortunately, many teenagers are seriously hurt or even killed each year from injuries or violence. Listed on this slide are many things identified by the CDC that contribute to physical and emotional harm to young people. Have you known anyone who has been affected by alcohol, violence, or other risky behaviors? Have you known anyone who has intentionally hurt themselves? How did their family and friends feel? It is important for you to keep yourself out of risky situations and avoid risky behavior. If you're involved in risky behavior and don't know what to do, talk to someone. Many are available to you, counselors, teachers, nurses, and other trusted adults. If you feel emotionally out of control, anxious, stressed out, or depressed, talk to someone. Many teens are victims of bullying or harassment. Stand up for yourself and others against bullying. There is strength in numbers. Make sure the group you hang with does not bully or harass others, and make sure your group stands up and reports bullying. You're not being a snitch. You're being a responsible, mature person. The person doing the harassing needs to know um, as much help as the person being harassed or bullied. People who bully others are not meeting the essential human needs in healthy ways. The person bullying others needs help from a trusted adult who cares. While we all experience emotional changes that are normal, it is important to be aware of negative feelings that can be harmful. While most teens do not experience serious emotional problems, if emotional outbursts are getting you into trouble, you feel sad, hopeless, worthless, or if you're so down that you have thoughts of hurting yourself, you must talk to someone. Speak to a school nurse, counselor, or call the National Suicide Prevention Hotline. Remember, you are unique, one of a kind, like no one else in the world. Has anyone around been around someone suffering from smoking related illnesses? How does that person feel? How did it make you feel? Hundreds of thousands of people die every year from smoking related deaths. It's important to start making good choices now. Don't start smoking. Most adults who are suffering from the many consequences of smoking began the bad habit when they were teenagers. They thought it was cool or grown up to smoke. Of course, the opposite is true. It's cool and showing maturity not to smoke. Most people now know that smoking is very unhealthy. Also, many young people think that they can stop smoking whenever they choose to do so. Adults who smoke will tell you differently. It's extremely difficult to quit smoking because it is very addicting. Alcohol and drug abuse and distribution have negatively affected many families. It's important now to decide not to fall victim to alcohol and drug abuse. If you have to use drugs or alcohol to have fun or feel good, you are in a seriously harmful situation. Unfortunately, many successful actors, athletes, singers, business executives, and others have destroyed their careers and even lost their life because they resorted to drugs to find pleasure in life. If you're using drugs, stop now. You could seriously harm yourself and others. Also, possession of illegal drugs can lead to imprisonment and a lifetime criminal record. This could make it difficult for you to get a job in the future. If you need help, seek assistance now. Asking for help never means weakness, it signifies courage and intelligence. Smart people ask for help. Don't use any prescription medication that is not prescribed by a healthcare provider for your use. Never use illegal drugs. They can be addicting, they can cause serious bodily harm or injury or death, ruin your future as a result of jail time if convicted of possession. Unhealthy eating is the reason some people feel tired and drained seemingly all day. It is also a major cause for obesity and cancers. If you're overweight, you can lose weight, but you must do so safely. The best way to decrease the amount of food is to decrease the amount of food you take in daily and increase your exercise. If you need help, see a healthcare professional. Many of you have seen the difficulties teen pregnancies and STDs can bring. If you have sexually active friends, strongly encourage them to go to a clinic to be tested for STDs and receive counseling on the use of birth control methods, including condoms, if they choose to continue having sex. Encourage them to consider abstinence. Pregnancies and STDs can change a life. The CDC has defined teens having sex as a health risk behavior, not a healthy behavior. It's easy to understand why, considering all the problems that occur to the hundreds of thousands of teens each year who become pregnant, get STDs, and suffer emotional problems from sexual activity. According to the CDC Youth Risk Surveillance, the number of high school students in the United States who have ever had vaginal intercourse has declined to less than half. That's great news. The government also reports that there have been substantial declines in the number of teen births, abortions, and those with genital herpes. In fact, 20 years ago, 500,000 teens gave birth to a baby each year. Today, about 400,000 teens have a baby each year. That's 100,000 less teen births per year. The good news is that more teens are getting the message that having a baby can wait until they are better able to care for themselves and the baby. Being physically active is an important habit to develop. You have to make time for exercise. One sure way of being physically fit is to be in an activity that involves exercise. Find something you like to do: dance, cheer, volleyball, soccer, gym, etc. Unfortunately, many middle school students stop involvement in activities that promote exercise and good health. Don't fall into that group. Teens who stay involved in sports and other school activities do better in school and are less likely to get involved in risky behaviors. It is also important to watch how much time you spend in front of screens. Medical experts recommend we exercise 60 minutes a day, most days of the week. If you can't find time for exercise, you will have to find time for illness. Increased sun exposure and tanning damages skin, leading to a premature skin aging and skin cancer. If your skin is exposed to the sun, it is important to use sunscreen to protect yourself. Indoor tanning is not safe, it damages your skin. Getting sleep is important. If you don't get 8 hours, get as close to that as you can most nights of the week. It's important to avoid all health risk behaviors. Smoking could lead to other drug use. Alcohol use could alter behavior and lead to sex or other risky behaviors. If you're hanging with a group that's involved in any of the risky behaviors we've discussed, encourage them to stop and, if necessary, seek help. Be careful who you hang with. Choose your friends wisely. The leading causes of death in adults in the U.S. are smoking, unhealthy eating, leading to obesity and physical inactivity. Often, unhealthy behaviors begin in the teenage years. If you establish healthy habits as a teen, you have set yourself up for a healthy adulthood. It is never too late to stop unhealthy habits and to start healthy habits. While not all accidents and injuries can be prevented, many can. Always wear a seatbelt. Never ride in a car with someone who has been drinking or driving recklessly. Alcohol and drugs can increase your chance of being involved in an injury. Many teens are killed in violent crimes each year, especially related to gangs and drugs. Too often, teens may feel down and depressed and don't ask for help. Don't let it happen to you. You are worth it. Life is worth it. There is a way out. This lesson focused on the importance of avoiding health risk behaviors. It's also important for you to see a healthcare provider on a regular basis and to make sure you're up to date on all recommended vaccinations. You're now at an age where you can take responsibility for many aspects of your health, such as healthy eating, exercise, avoiding health risk behaviors. You can also be an example for your friends and family members. It is necessary for us to recognize the health risk behaviors not only in ourselves but in those around us. If someone you know has an unhealthy behavior, be considerate of their difficulties and try to support them in developing healthier habits. If you have a healthcare concern and are not sure where you should go or what you should do, consult with a trusted adult such as a parent, guardian, the school nurse, or a counselor. They will be able to direct you to the proper healthcare facility. Avoid risky behaviors and protect your future. When you hear the word abstinence, it refers often to not having sex. Remember, abstinence from all risky behaviors protects your future health, happiness, and success.